Welcome and thank you for joining us here at the Institute for Life Course and Aging at the University of Toronto. We are pleased to have you here with us for our noon hour seminar series. This is the second seminar in our series this year. And welcome to all of those who may be watching on the web. We will also be archiving this webcast at a later time, probably today, so you can always see it again later. I just wanted to let you know that we do have a list of other seminars here for those of you who are here, and you're welcome to pick up the list and or let us know your email if you want to be on the list to hear about future webcasts. If you're watching the webcast and you want to join in our seminar mail list, you can send your email to aging@utoronto.ca. We are very pleased to have with us today Alexandra Rowland. Alex is a student in the Department of, or the Institute of Medical Science. She's a doctoral candidate here, and she's been working with Dr. Sandra Black and Ora Kagan at the Aphasia Institute, and our own director, who's currently on administrative leave, Dr. Lynn McDonald. So on behalf of Lynn and everyone else, Lynn can't be here today. She's out of the country in Israel, but on behalf of everyone here, we want to welcome you, Alex, and we're very pleased to have you here today. So, right ahead.
Thank you, and thank you for inviting me to come today. And this is a topic that's very near to my heart. I was a speech-language pathologist before I started pursuing my doctoral studies, and I had a patient, and he was a comparatively young gentleman. He was just 63, and he had a very specific stroke. So he was able to walk, he was totally independent, but his aphasia was so severe, it was such a barrier to his life. And he was in desperate need of counselling to try and overcome this monumental change in his life. And it didn't work. Not with myself and with the social worker working together as a team. We just couldn't reach him. So it set me thinking, here is a population who is in desperate need of healing therapeutic conversations, whether it be with a healthcare professional in the moment, or whether it's more formal counselling. So this is the reason for my topic today. So I do want to acknowledge Alison Tedesco. She's a social worker. She works at the Aphasia Institute in Toronto, and we worked together in developing this framework. So she was unable to be with us today, but she is absolutely front and center as well with this approach we've developed. So what I would like to do today is talk a little bit about the definition of what is a difficult therapeutic conversation. Indulge, if you allow me, into a bit of self-reflection about your comfort level with dealing with emotion, and then move on to the framework that we've developed, where we're looking at the person and weaving together counselling skills and some communication strategies. And then we'll look at some problems and solutions, and if you have any questions, and I don't know how interactive the webcast is, but if anyone who's watching this has any questions, we can discuss them together. So, a difficult therapeutic conversation. For the purpose of this seminar, I would define it as any conversation in the moment with someone who's providing some sort of health care to an individual. And in the case we're going to be talking about, an individual with aphasia. It's where that person is expressing some sort of emotion. When they're maybe making a significant decision about maybe leaving the hospital, their discharge destination, or what have you. Or someone has made a decision for them, or is strongly advising a certain route to take, and they're in opposition to that decision. And that, of course, can lead to a difficult therapeutic conversation. Or even more difficult in some ways. It's just what is extremely important and significant to that person. And the reason why I say it's a little more difficult is that you're going to try and find the root cause of the emotion and the difficult conversation you are engaged in. So what I would like to do now is to tell you a bit of a story. Now this really happened. This is an example of what really happened. There was this particular individual who has had aphasia for around approximately 5 years. He is an academic of extreme renown, not only here in Canada, but in the United States, in Europe, and in many other countries. He is very well published, very well respected, and has been on the faculty at a number of universities. And he was being interviewed sort of internally, but he was being interviewed because he's led such an incredibly interesting life. And through his aphasia, he was able to talk about all of his achievements. And everything was going extremely well. And then he absolutely broke down and started sobbing and just saying, "That man is dead, that man is dead." And what do? It was such an intense emotion for him. So I'm going to throw it out to you a little bit. If that had happened with you, what do you think you would do? How would you feel? Any thoughts? Anyone brave enough?
Oh, maybe uncomfortable or sort of uncertain what to do next.
Yes, absolutely. You're going to have to make a decision, because what he's giving you some very extreme emotion and extreme communication. You can't just leave it. I don't think anyone here would be comfortable in just leaving it. But, what are we going to do? So, this is why I want to indulge, if you would allow me, into reflecting on how you would feel. When working with anyone who is going to potentially have any emotion, we really do suggest that you reflect on how you feel about emotion yourself. How do you intuitively react to displays of emotion? What do you feel? What do you do? What makes you feel comfortable or uncomfortable? And the reason why I'm asking you to reflect on this is if in the course of your work you are ever interacting with anyone with an aphasia or any communication barrier, what you will feel will be magnified because there will be that communication barrier. And what we sort of suggest is, if you have these difficult conversations, these sort of therapeutic, challenging conversations, afterwards really reflect yourself, how you felt, how it made you feel. Maybe write it down, maybe talk about it with someone. Because people with aphasia have reported to us many times that because of the communication barrier, a lot of people don't let them express emotion. It's just all too difficult. So, what we're going to do today is we're going to look at a framework that Alison and I developed, and we're going to be weaving together 3 strands in this framework. And that's why you see on the right-hand side and on all the slides, there's sort of, actually it's like a Celtic knot. We're going to ask you to consider weaving them together. It would be wonderful to give you a recipe today and just to sort of say, in this situation, do this. And just some people are joining us at the moment. So, but in this situation, you do this, and it's like a recipe. First of all, you do this, and then that will lead you on to something else. But it's not going to be like that. So the 3 elements we're asking you to look at in the moment, in these difficult therapeutic times, is look at the person, their emotion, what message are they giving you? What are the circumstances? Think about the person's identity. Do you know anything about their history? Have you got to know them through a chart review or something like that? And then bring into play the counselling skills. And we'll be talking about those as well. And then weaving in together are the communication skills that I'll be introducing to you today. So, we're now going to focus on some of the counselling skills. And is anyone here from social work? Excellent. So you'll know a lot of these counselling skills. And where are you guys from? Oh, excellent. And
doing research at the university.
Excellent. Terrific. Okay, so a lot of this you'll know, but it will be especially useful for the people also on the webcast. So, addressing the emotion. Okay. By ignoring someone's display of emotion and avoiding a discussion about how someone's feeling, or even racing to try and find a social worker, the message we are giving people with aphasia is that it's not okay to feel. And we have to be brave ourselves and let them know that it is okay to feel. And as I said, people with aphasia have reported that they are frequently ignored because the barrier is just too big to overcome. And for those of you who don't know, there's an extremely good book here called Talking About Aphasia. And it's written by Susie Parr and Sally Bing from Connect over in the UK. And this book is actually a series of interviews of people with aphasia and how they feel. So actually talking about emotion and the devastation of having a stroke. And I'm just going to give some of the quotes because these are in the words of people who've had aphasia. "Oh my God, I want to die when I could not speak, because I know I could not live that way." And talking about the feelings of isolation, cocooned in this lonely shell, or stuck inside. And one gentleman just talked about being derelict. His life was derelict. It was the way for him to convey his feeling of devastation, loss, and loneliness. So, we're going to move on to now some more counselling skills, which we can all use, all health professionals can use. And we've talked about addressing emotion, and acknowledging emotion is so important. And, you know, unless you're a social worker, we often don't practice these skills, and we don't practice this vocabulary. But it really is important for all of us to do it, to just sort of practice. I can see how hard this is for you. You know, I can see how you are upset or how you're angry. And by acknowledging it, you're going to stay with the emotion. And this is what people want. They want their emotions acknowledged. By doing that, we're also providing a safe place for people to feel that emotion. It's okay to cry. It's okay to feel that angry. And, you know, when the emotion comes out, this is the way we're moving forward. And also, so we've been thinking of the counselling skills of the acknowledging of the emotion, but I also want people to remember that emotion is communication. Displays of emotion, that could be the only way a person with aphasia can communicate. And sometimes they will almost exaggerate displays of emotion in an effort to get your attention and to keep your attention. And when you actually delve into, using some counselling skills, delve into what the problem is, it might not be as extreme as they're portraying. But you can read what the person with aphasia is giving, and then you can reflect that back. And by reflecting it back, you have told the person with aphasia, I have heard you and I've respected your communication. And even if they can't let you know what they're feeling because of the barrier, they can't produce the words, they can't speak, they are giving you something. And we can work with that. So you've acknowledged the emotion. And with counselling skills, it seems very similar, but it's actually slightly different. You go ahead and you validate what they're feeling. And you can do it, these are some of the suggestions. Of course you're feeling angry. Of course you're hurting. This is very difficult. You have had a stroke. And sometimes I think as health professionals, we're almost apprehensive to talk about the fact that they have had a stroke. And life is devastating because we see ourselves as trying to fix things. And we don't want to, it's uncomfortable at times. We just want to take them down to therapy and try and fix it. But we do need to validate it. And by validating it, you're also telling them that they are normal. It is normal to feel this. And when any of us feel intense emotion, and then someone reassures us that what we're actually feeling is normal, it can really help to dissipate some of the intensity of what we're feeling. It's healthy to tell our patients, our participants or what have you, that it's part of the normal recovery and healing process. And also just to bear witness, just to be there in the moment, to hear, to acknowledge and to validate. And I would go so far as to say, if you can do those three things alone, then you have had a successful interaction, you have had a successful conversation. Okay, so we've talked about the counselling and some of the things that you can do, some of the things that you can say. What I want to focus on now is your skills as a healthcare professional. Now, fortunately, here in the audience today, we've got quite a few speech pathologists, so this will be very familiar to them. But for those who this different style of communication is new, we'll talk about this. So we're asking you to use some other strategies, such as gesture, facial expression, tone of voice, in your communication style, in this difficult moment, in this moment. And we're doing it for a couple of reasons. If you use natural gesture and facial expression, you're giving a very good model to the person with aphasia. And you're almost giving them permission. You're saying it's okay for you to use these skills back. And in essence, what you're doing is you're making a very unusual conversation normal. Because normally when we're talking, we're relying on our vocabulary and it's all very quick. But when you've got this communication barrier, you've got to try and make the person with aphasia at this time of emotion feel as though they're participating in a normal conversation. So if you're expecting them to do it, to give you extra information through gesture, etc., and you're not doing it yourself, then the whole conversation lacks balance. Also, of course, we're doing it to help to get the message in, to make sure that the person with aphasia is understanding you. But you see at the bottom that we've put down the importance of authenticity. And again, I would suggest, especially to people who aren't used to communicating in this fashion, to actually practice. Even if you're driving in the car and you've got your vocabulary of normal counselling, the types of expressions that you would say, just think about your tone of voice, just think about the gestures you would use. Start sort of chunking the information. Start practicing these skills. And actually that's going to lead me on to, I would like to do a small role play now. And for those who are watching on the web, you can do it yourselves. If you're watching in a group, do it together. So what I would like to do is maybe ask Elise just to come up here. Don't worry, you don't have to do anything.
Sure.
And it sounds so easy to do. And when you get into the flow, it is indeed easy to do. But practice, because to begin with, it's unusual. Okay. So all I'm going to say to Elise is, I can see that you're hurting. It's okay to cry. Okay. So I can see that you're hurting. It's okay to cry. Right. Thank you so much. And you're just doing a very natural gesture, but you wouldn't have done it before in the counselling session. The thumbs up, the okay, maybe just the gesture to cry. Okay? So what I'd like you to do is just to divide into pairs, and just literally to do that. Use your own gesture, use your own facial expression. I did it my way. And if, especially for people on the web, I don't know if you could see that I sort of chunked the information. I can see that you're hurting, and then the natural pause, it's okay to cry. All right, so if you'd like to, just with the person next to you.
Yeah, I didn't actually use very much gesture.
Excellent. Okay. So, and just reflect yourselves on how you felt doing that. Sometimes people begin with say it feels a little bit stilted. All right, so you're in the moment. You've been brave. You've stuck in there. You've acknowledged the emotion. You've validated the emotion. You're using some good communication techniques from the onset to normalize the conversation. What I'm going to strongly advise next is to limit the distractions that are around you. In healthcare, it's the noisiest, most distracting environment that anyone can possibly work in. So we're going to have to address this. So you need to be focused. You need to be focused so you can catch any piece of information that is given to you verbally or non-verbally. You want the person with aphasia or another communication barrier to be completely focused on you so that they can understand what you're trying to say. So some of the distractions, of course you've got the social distraction. Nobody is comfortable in displaying emotion in front of other people, and they will stop. So somehow you've got to engineer this, and we will talk about it. For people with aphasia, they have had an insult to the brain in the area of the language area. Their ability to concentrate and to pay attention is frequently affected. So by limiting auditory distractions and visual distractions is going to help their ability to get the message over and to understand what you're saying. And then, as much as you possibly can, remember how they are physically, because pain and discomfort is a huge distraction. And if somebody starts focusing on their pain or discomfort, you've lost them. And this could be a very healing conversation. So, some suggestions. If you possibly can, you might be in a busy physio gym or an OT room or something like that. If you can, some sort of physical barrier, such as pulling the curtain across, will help, but also if they're on their unit. If you can, if it is possible to shut the door, that would be terrific. But if not, maybe think about trying to move them to a corner of the room. Let them face into the corner, and you be in the corner facing out. So you're limiting distractions, and they can just absolutely focus on you. By offering some sort of sense of private space, we're preserving their dignity. And we're providing them with that emotional safety that is so important to pursue this conversation. Obviously, we're reducing distractions, and without doubt, it will help communication. So, what we're going to ask you to do next is to really hone in on your problem-solving skills. Look at the person and the situation and the context. You've let the person display their emotion, and now you're going to focus on these clues. Who are you? Are you an occupational therapist, speech-language pathologist? Are you a nurse? Are you a physio? Are you a social worker? Because if they're crying with you, that is a clue. It's something that you're trying to work with that could be the problem. Where are you? Now, it could be a situation where a social worker knows the client really well. And they've seen each other in the office, and there's a good rapport going. And maybe the social worker just happens to see the person and says, oh, let's go for a coffee. And they're just in a hospital cafeteria or something like that, and the person breaks down. Well, it's a different physical location. Maybe the person the social worker's developed a good relationship with, maybe that person is suddenly seeing everyone talking with such ease. And that is the trigger to break down. They feel safe with the social worker, but they're in a different environment and they break down. What's just happened? Maybe in occupational therapy, they've been working on dressing skills. Maybe it's someone's feeling an immense loss of dignity because they can't pull up underwear or something like that. What were you discussing? Nursing staff, maybe case managers are talking about discharge. I think all of us know here how emotive discharge can be. It's not just a set of physical problems to overcome, such as adapted bathroom equipment. People who've had a stroke or a head injury and a resulting aphasia, their identity can change, and change significantly. And sometimes in a hospital setting, they can feel safe. And the thought of going home and coping with life, but not being able to communicate, can be absolutely overwhelming. What do you already know about this person? What do you know about their relationships, their friendships? What do you know about their compliance, their motivation? All these are clues and cues to help you. And what's going on in the individual's life? Do you know how the family are responding to this? Are they having tremendous problems in accommodating this barrier of communication? So if you can problem solve And this is why I'm going to take you back to the weaving. Okay, so you've looked at the counselling skills. Now you're looking at the person and all of their context. And I know it's a lot to do in the moment, you know, it's all very well me standing up here saying this is what you should do. But we're looking for what triggered that intense emotion so we can address it. That's the reason why we're doing it. So now, the third element of the weaving is communication. And I'm going to talk to you today about supported conversation for adults with aphasia. Now this was in large part developed here in Toronto at the Aphasia Institute, and it's undergone psychometric studies and it's proven to be an extremely efficacious and valid way of communicating to people with aphasia. I also have to say it's extremely good for communicating with other people with barriers as well. Okay. So I want to talk a little bit about the philosophy, because the philosophy ties in so neatly into counselling skills. So, the philosophy behind the framework is that human beings reveal actually not only their competence, but also their identity, who they are, through conversation. And conversation can be seen in two ways. Without doubt, when you're talking, you are exchanging information, which of course is what we need. It's extremely efficient. But in having a conversation, you are also developing and maintaining social and emotional interactions and connections. So we talked earlier about the importance of acknowledging emotion, because if you acknowledge it, you're telling someone it's okay to feel it. And that's in the counselling situation. But what I'm going to say is that it's as important to acknowledge the competence and identity of someone with aphasia. Now, this is, for some people, a hard concept to grasp. Okay? If someone can't communicate to you, a lot of people think, well, their understanding must also be significantly impaired. They haven't got it. What I'm saying to you is a stroke or a head injury that affects the language areas of the brain, indeed affects language, but it doesn't affect the same way someone's ability to think or to process information about their world. So, people who've had aphasia, who are in a hospital bed and they're frightened and they're scared and they've also had a stroke or a head injury, many people around them are treating them as though they don't understand and that they are not competent to make a decision. Be it a small decision about going for a bath or going down to physio to practice walking, or whether it be a large decision about consent to treat or consent to make a decision about discharge. So the mere fact that in this difficult therapeutic conversation, you can say, I know what you want to say. I know you know what you want to say. But you're having problems getting it out. And here, this is a slide developed by the Aphasia Institute that's used in many of their education programs and information. We're saying to people with aphasia, we know that you are still intelligent. We know that you know what you want, that you are an adult, that you are competent, and you can make your decisions. And I don't know if it's the experience of the people, the speech pathologists here today, But sometimes when I have been talking to someone with aphasia, and I just say to them, I know, you can feel the tension subside. It's almost palpable. Would you agree? Excellent. And sometimes, because don't forget, we are talking, the topic of today is having this difficult therapeutic conversation. You've acknowledged their emotion. If you also go ahead and acknowledge that they do know, then some of the tension can be resolved, and you can go ahead and hopefully have a good and productive conversation. So, what I love, as I said at the beginning, I come from speech-language pathology. What I love about my profession, and I think it applies to many professions in healthcare, is that what we do is both an art and science. And you have to know humanity, and that's the art side. But also, sometimes in our work, it's just good to use logic. And sometimes I think the framework for supported conversation and for us to help someone reveal their competence and reveal what they're feeling emotionally, sometimes I think it's just good if you think about it logically. You want to get your message in so they understand you. You want to help them to get their message out. And then you're going to verify what they've given you. So talking about getting the message in, and this will be familiar to some of you. Talking clearly and in short utterances. By just breaking up the information, you're giving the person with aphasia time to process what you're saying. Okay. Writing down key words, and we're going to be talking about that in a little bit more detail. That helps to get the message in. Sometimes just drawing, and a lot of people have problems with this, and they say, yes, but drawing can be a bit demeaning. It's a bit childlike. Well, I tell you, if you're just going to draw a house, sometimes that very quick picture of a house can carry a significant amount of meaning, and it's fast. Because don't forget, in an ordinary conversation, we're speaking quickly. When there's a barrier, it slows everything down. Using resources as well, such as maps and calendars. If you're in a hospital, grabbing maybe some information on food or what have you, information on physio. Using gestures that we talked about before, pointing, facial expression, and any aphasia material, aphasia-friendly material you can access. And what we mean by aphasia-friendly material is maybe material with some pictures, or maybe with the amount of written information is reduced and some of the important words are in bold. So that's what we mean by aphasia-friendly material. Now, again, we're in this difficult therapeutic conversation. So if all you can do is just grab a sheet of paper and a pen, this is going to help you enormously. So maybe you're still in your physio gym, and they're in the wheelchair, and they're facing into the wall, and you're facing out, and you've just grabbed, I don't know, just some piece of paper and a pen. You can start. And writing down keywords can really be helpful for a number of reasons. You're going to write down the words that carry the most meaning. Now, generally, that's going to be nouns or verbs, sort of, like a basic emotion or something like that. Why it is so helpful is that it not only helps to get the message in so they can understand, but then you have it. It's frozen in time. It's concrete, it's there. They can refer back to it. We can refer back to any part of the conversation we want by just saying, oh, do you remember when we were talking about counselling skills? And you're there, and I'm there. A person with aphasia can't do that. So if you've got something concrete, that is going to help you. And what is very important is that you write down the words as you are saying them. If they can hear the word in the natural context and see the word as you are saying it, it will, even with someone who's got problems with understanding because of an aphasia, it can potentially help them. So, I have done some education on supported conversation, and I find, especially for people from other professions in speech pathology, some of them have said, yes, but what keywords do we write down? Because, some words can be important. Are you writing down 6 or 7 words? So I thought what we would do is go through a scenario and think about the important keywords that someone would write. So, again, we're going to be weaving, we're going to be looking at the contextual clues as well. So we're in a physio gym, and a patient has been practicing sit to stand transfers, okay? And they're getting frustrated. And they're going to break down. And in this case, it doesn't appear to be the emotion of sadness. It appears to be the real emotion of frustration. Okay. Well, you're going to obviously use the context, and here you are in physio. Okay. So you've told me you're frustrated, and I want to know why. Is it you're walking or something else? And here we would probably use the words of walking. But I am going to encourage everyone to use the or something else, because logic tells us it probably is something to do with walking. But we've got to give them the opportunity to let us know that actually, no, it is something else. So here the person has chosen something else. Now remember, this is just you writing in the corner of the room, or in the physio gym. Okay, so they're telling you no, it's something else. So think back to any clues that you have, any life history information from the referral. Work with the information you have. And we're going to suggest that you start broad, but start concrete. So here, this is what I would probably suggest. Is it about your stroke, or is it something else? And in this situation, the person did point to the stroke. And again, think of the person. This is the difficult conversation, okay? Think of the person. How old are they? What's their family like? Are they living on their own? Are they widowed? That will determine what words you choose to try and find out what the problem is. So, if they are 55 and you knew that they were working full-time for the stroke, you would include work. If they're really connected to the family, you might be including that. And again, don't forget to add other. And here, this is one of the wonderful things I told you, the social worker, Alison, developed this with me. She keeps on reminding us here, is remember, you're not trying to fix the problem here, you're trying to get information, okay? And then by getting the information, you can channel you've heard them, you validated them, and then maybe you are appropriate to talk to them further, or maybe you can point them in the right direction. So in this particular case, it was a young gentleman, and he broke down, but it was in physio he broke down, and he did indicate that it was work. Now, I absolutely recommend, and I'll be saying this a number of times, verify. Verify their response. So, are you concerned about work? And you can write yes or no. It will save you time. in the long run. Because if it actually wasn't work, you could be sidetracked. They choose yes. Now, let the severity of feeling guide where you are going to take your conversation next. What would you say to someone who could talk about their problems with going back to work? So are you wondering if you can return to work? And you've already got work written out there. You already know and established that you're talking about work, so you don't have to necessarily write that down again. So are you wondering if you will be able to return to work, yes or no? And then, it's going to be up to you and your clinical judgment on how you answer that question. But don't forget, as you go through this process, write down the keywords, use gestures, facial expression, etc., to help the person to understand your message. Okay. Now, actually, I'm just going to go back. So we've got a lot of keywords written down. Not only did that help to get the message in, but you gave the person a vehicle to get the message out by giving them choices such as yes, no, by giving them choices such as was it family, work, home, etc. So by doing this, you've actually worked on two elements of a supported conversation. And the third element is verifying. Now, verifying is particularly important when you're thinking of counselling. We have one social worker here, and I know one of the social worker's skills is to paraphrase in a counselling situation. You paraphrase what the person has given you to let them know you've heard it, that they've been validated. Okay? Now, you have to make sure that you have fully understood the message before you can employ the counselling skill of paraphrasing. Okay? So, we're going to move on to another example. So you have a client, maybe it's a discharge planner or social worker or case manager, and they're with a client, and the client is just going home, no, 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 home, no, and they're distressed. Okay. So you've got to try and get their attention, and you've got to figure out what they absolutely mean. So you're going to break it down. You're going to start off with home. Do you mean nursing home or your house? If you're just writing nursing home or house, then you're getting the message in, but you're allowing them to get the message out. Then they might go on. You said no. Does that mean you don't want? And here I would have written don't want. And then you've got the nursing home, so you needn't write it again. You don't want the nursing home, or is it something else? Maybe they point to don't want. And then in your counselling situation, you can paraphrase and reflect back and validate. It's going to be a change. It is going to be hard. But that person could have been saying no, 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 home, no, because they didn't want to go home, because they're just overwhelmed and they can't cope. So that's why it is so terribly important. Because, are you counselling someone to go to, the change of the nursing home, when it actually could be what they want? So that's why it's important to verify before you counsel. Another extremely important, and I can't stress this enough, reason for verifying is that you're acknowledging success. Don't think for one moment this isn't hard. This is hard. But if you can clearly verify that they got the message over, that it is about work, if you can only get to the stage where that gentleman is concerned about going to work, you've been successful. He's got a lot of information over. It's very hard work, but that success will motivate you to continue. and you're both building confidence. So now the last element that we're going to talk about today in the counselling situation of people with aphasia or another communication disorder is assessing the degree of emotion. How much does someone feel something? And why is it important? It's important for counselling, but it's also extremely important for things like, do you need to change discharge plans? Do we need to get the family in? Is someone so resistant to a discharge plan that they are preventing the natural healing process and they're going to need a lot more help? Or is it actually they just need some more information? Maybe a brochure. So how you address this will be determined in some part to the degree that someone is feeling an emotion. Now, in social workers will frequently use different words to try and get at the degree of emotion. So we've got the example of angry. Well, with angry, I mean, at one end of the scale, you can be incensed. At another end of the scale, you can be put out. And it's everything in between. Someone with aphasia might very easily understand the concept of angry, but be unable to really tell them to the degree to which they're feeling. And if someone's saying, well, does this incense you? They could understand anger, but they might not understand incensed because of the language being affected. So again, you're going to talk, you're going to use keywords, but also start using a scale. And again, you've got your piece of pen, you've got your paper, it can be quick. So you say you're angry about going to a nursing home. Show me on this scale. Are you very angry, extremely angry, or just slightly angry? And let them show you. And I will remind you again that this is important for people with aphasia because they could be using anger as a tool, as a vehicle to get you to pay attention to them. Now they've got you. Maybe actually they're not so angry about the change in discharge plans. And that's why it's important to find out. Again, at the Aphasia Institute, we've developed some materials that could be useful. We've looked at different emotions here: lonely, depressed, frustrated, angry, and the degree to which they're feeling them. Are you always lonely? And this is incredibly important because, let's take frustrated. They could be immensely frustrated in that physio gym, in that period of time, and they want to express that. But they're not frustrated always. It's only sometimes. So are you always frustrated? Never. Or is it somewhere in between? So I'm going to address the next few slides, and it's going to be a summary of what we've talked about today. Why must we include people with aphasia in these difficult conversations? It is their human right to be included and to make decisions. But if we don't, the consequences can be very much worse. We talked about a little bit, and they had some quotes in this book about feeling so isolated. But people can also begin to feel locked in, and their only way to try and unlock themselves could be through a more aggressive nature, and behavioural problems can start. And these can lead to mood alterations such as depression. But if we're all brave enough just to have that conversation, and it is going to be hard, but if we can start weaving together some of these things that I've talked about, then hopefully we'll allow the emotion to come out, and then it can be addressed. And Joseph Jaffe, this is an amazing quote, and I am going to actually read it. People with aphasia, however, have lost the very capacity for healing conversations with others. Their disease is essentially cruel because it interferes with the major vehicle of its own treatment. Talk therapy. That's what people are talking about. But if you can't talk, you're not going to benefit. So, remember, we want you to have a successful therapeutic conversation. You might not get there at the first time, at that moment of crisis in the moment. But if you can identify the emotion, if you can verify it, if you can stay with that emotion by acknowledging it and validating it, and then if you can reassure them that you will come back, then you have been successful. I know we haven't resolved this yet. We will. Maybe you need some more information, and you can tell them that. I need more information before we go further. But however much information you get, acknowledge the success of that information, because from a counselling point of view, you're developing a relationship. If you can just understand the emotion, as I said before, and validate it, and acknowledge the success of that, you made it clear to me you're angry. You did it. You got that over. You communicated that. And that success will hopefully give them the motivation to pursue it, then or at a later time, and you're building confidence. So, our approach, you're looking at the person, the information they're giving you, the context, situation, their emotion, their history. You're weaving it in with the counselling skills that you are using in the moment. And then you're going to also use and weave together the communication strategies. It's a vehicle for providing support. So, I have some further education ideas that we put together. Counselling skills within your profession. There are courses in supported conversation at the Aphasia Institute, but also try and find out if your speech pathologist has already undergone some of those, because a good conversation with your SLP might really help you. Seek out counselling skills from other members of your team. If you have a social worker on your team, maybe you can talk about it. Sometimes you develop a relationship with someone and you are that person to bear witness. For people who are not SLP, seek out communication skills from your SLP. Maybe ask to observe them and how they interact with people with aphasia. Read articles, books on counselling. I think there are some pretty good books for every different health professional on counselling with this population. And then I would just like to end today by acknowledging the Aphasia Institute. As I said earlier, Alison Tedesco was the social worker, but we also relied heavily on Charlene Sherman, who is another social worker at the Institute. And then my doctoral supervisor and committee, Dr. Black and Lynn MacDonald, who is the chair here, or director. Aura Kagan, who's the executive director at the Aphasia Institute, and also the Heart and Stroke Foundation, who very generously gave me a grant to develop some of this. And we are developing now, in fact, actually, we're well on the way, of developing supported conversation specifically for social workers, where we actually go deeper into the communication skills used by social workers and counsellors, and how we can weave together supported conversation. So, thank you.
Does anyone have any questions they'd like to ask Laura? Alex?
Yes, question.
We do have one from our webcast audience. They'd like to know the title of the book.
This
And the author.
of this, the book here, the Talking About Aphasia.
Yes. So it's talking about aphasia.
And it was written by Susie Parr and Sally Bing, B-Y-N-G. And it's Open University Press. Do you guys know this book?
It was Judy Parr and Sally.
Susie
Parr and Sally. And the year?
2003.
Thank you.
Are there any other questions?
Oh, there's another question. Sorry, I think we'll answer that first. That course is at the Institute.
Okay. Terrific.
Anyone else? You'll see that you have a seminar evaluation form in front of you. If you'd like to fill it out, we'd appreciate it. And I want to thank you so much.
Oh,
that was wonderful.
you.
Alice. Thank you. It's just a small token of our appreciation for your talk today.
Excellent. Thank you.
Still recording.
All right.